FAQ, breast reduction, or breast lift. These operations are very similar. Breast reduction, you remove more breast tissue. Breast lift, you remove more skin, but they're essentially the same surgery. So FAQ, breast reduction lift. Number one question I get asked, particularly by young women, is will I still be able to breastfeed? So about 30% of women can't breastfeed at baseline. They don't make enough milk, the baby doesn't latch, whatever the problem is. About 30% of women can't breastfeed after breast reduction or breast lift surgery. We don't cut the milk ducts. The milk ducts are kept intact all the way to the nipple. So theoretically, you should still be able to breastfeed after this surgery. I just can't guarantee it because I don't know that you can now. Second most common question, will I still be able to feel my nipples? Nipple sensation is preserved in 95% of patients. 5% of patients will have some degree of nipple numbness. I can never predict who's going to be in that category, but it happens about 5% of the time. I do a lot of breast surgery, so I see nipple numbness at least once a year, and I never know who it's going to be. The good news is that the vast majority of patients will have normal nipple sensation. FAQ breast reduction scars always come up. What are the scars going to be like? There's a couple of different scar patterns that you can use for breast reduction surgery. The one that I use in almost everybody is called the Lollipop Scar or the vertical breast reduction, and that's going to be a scar around your nipple-areolar complex and a line that goes up and down like a lollipop. The other scar that's very common is called the anchor or wise pattern scar, which looks like a circle around the nipple, one that goes up and down, and then a big one in your inframammary fold, like an upside down T or an anchor. I don't really favor that scar because I think you can do most of these with a vertical or a lollipop scar, but sometimes if a patient has just a ton of extra skin, you do need the anchor scar.